here, and thank you all for welcoming me into your space. For those of you who don't know, Kelly and I go way back. We overlapped at Howard way back when Kelly was studying for the MCAT. She was pre-med before me. Um, I'm going to launch very quickly into our discussion tonight on writing for advocacy. I'm just going to try to share my screen real quick. I think sharing the second screen works. Actually, yeah, that works great. Are you able to see my slides?
It's loading right now.
It says that my screen sharing is paused. Let's see. Are you seeing the slides now?
Now we are.
Great, awesome. So as Kelly mentioned, I have been doing quite a bit of writing for the last few years. So a little bit of background. The first time I actually wrote something about whatever was going on in the public sphere that enraged me. It was when Justice Scalia basically said that Black people were maybe not qualified to attend highly selective institutions, and that's why perhaps we don't do nearly as well. And ever since then, basically, what fuels a lot of my writing is speech, and just generally being upset at something that is going on, and using the sort of ability that I have in terms of putting words together to express that rage. So very quickly, we'll talk about our learning objectives, right? So everyone who is participating tonight, I hope you'd be able to appropriately frame an op-ed or a perspective for the right audience, understand the process of choosing an outlet for your writing material, draft an appropriate pitch for a lay press op-ed, and think about how you may leverage social media both to amplify the material that you've written, but also potentially to seek out opportunities to get your work published. So first, I'll talk about some key questions that I ask myself before I start writing an op-ed, and I think everyone should ask themselves before they start writing, and then thinking about what are the things that go into an op-ed, the op-ed structure. We'll talk about pitching an op-ed, like the process of pitching. I'll share a because isn't complete, but I meant to add the next few things. So we'll go over a few different types of op-eds that I've written to sort of think about how you frame a piece for an audience. And I hope with enough time that we'll at least practice writing the lead for an op-ed and also drafting a pitch. And I will partake in the exercise. I want to be considerate that not everyone feels comfortable sharing, but I will invite those of you in the audience that do feel comfortable to share perhaps like your pitch or your lead about an issue that you care deeply about. So here are the first questions that one starts writing is thinking about it, especially if you're writing for advocacy as opposed to simply writing a story, is who are you advocating for? So are you advocating for yourself, right? Are you advocating for a given community, broadly defined, right? But a community that you belong to or you belong in. So for instance, I write a lot about the experience of, say, Black medical, I write about the experience of Black medical students. That's a community that I belong to. Write generally about the experience, of being somebody in higher education, right? But then you may also be writing for others who, in one way or another, you have a relationship with. So for instance, if you are as a medical student or as somebody in healthcare, writing, say, with the patients that you see in mind. If you're writing, about children in foster care or people experiencing homelessness, people who are incarcerated. So thinking about who you are advocating for and what is your positionality vis-a-vis the person that you're advocating for is, I think, first and foremost, what you need to think about to help you frame whatever you're writing, be it an op-ed or a perspective. Next is think about who your audience is. So are you writing for other medical students? So sometimes there are pieces that I've written where I'm like, I know another student is going to read this, and this is not like the general public. So, peers, are you writing for faculty to read something and then for them to be like, oh, I want to change something about how X, Y, Z happens on the clerkships? Are you writing for people who say work at the AAMC to make some changes in the process for, say, medical school admissions? Are you writing for policymakers, right? Be it at a local or federal level? So think about who the audience is incredibly important in terms of like, what are the arguments you're going to make and what are the counter arguments that you're going to expect? Um, and then what's the goal? Are you writing to raise awareness around a specific issue? Or are you writing to just shift the conversation? There are times where, for instance, like I'll use the opioid epidemic as an example, or the opioid overdose epidemic as an example. For the longest, right, the conversation in the media was around the way, disproportionately white people were dying of opioid overdoses. But what was missing in that conversation was that over the most recent years, Black people have actually seen, right, the steepest increase in overdose deaths. So someone wrote an article, I remember, in Vox, right, to say, hey, this is something that's missing, right? And so if you're writing to shift the conversation in order for people to pay closer attention to an issue that you deeply care about, or to an angle of an issue that you care about that is missing, that's an example. Are you writing to contribute to sort of actionable policy change, right? So these things shape the argument that you make and the recommendations that you make in the piece that you're writing. So the next thing, and okay, now it's time to think about, okay, I'm gonna write this op-ed, right? So I think for me, and more people should probably adopt this, is thinking about who you are, right? And earlier, I say, who are you advocating for and who your audience is, but who are you, right? Which identity or whatever are you bringing to this conversation as the person that is writing, right? What is your expertise and what are your limitations? So for instance, as a medical student, I'm finishing medical school. I have certain expertises, right? I have extensive sort of expertise when it comes to like substance use disorder, disparities, and like, prenatal substance use disorder, access to treatment, those kinds of things. I do not have expertise in, say, I don't know, disparities in access to DOACs, right? And so I will never write an op-ed about lack of access to DOACs, versus warfarin or whatever. Somebody else has that kind of expertise, and so really knowing what one's lane is, right? Like I won't write about access to, I don't know, monoclonal antibodies because I don't have the credibility, even though yes, certainly depending on the audience, to them I may be credible enough, but the reality is that it takes a great deal of humility as a writer to know this is not my beat, this is not my lane, and so someone else should write about this. And I'll come back to this later. The other thing is really knowing your stuff, right? And that's related to expertise and limitations, right? So for instance, there is not a paper, like I have a Google alert, right, for papers that come out about substance use disorder and disparities and differences between methadone and buprenorphine in terms of treatment, that kind of stuff. So I get an alert about literally everything that gets published on this subject, really stay on top of it from a research perspective. But I also, for instance, follow tons of people who are researchers in this space. So I really stay on top of the beat, right, that I'm following as someone who writes in this arena. And similarly for medical education, I have Google alerts for people, for researchers specifically, right, who do work that I'm interested in. Those are ways that I remain aware. And I read those papers when they land in my inbox, right? There's another thing that's really important is beyond reading on the subject is reading around the subject, right, before you write something. So for instance, if I write about discrimination in medical school, there are key papers that I will most definitely cite, right, because I know who those people are. But then there are, when I think what I mean by reading around the subject is thinking about, okay, who are the people that those people are citing, which are the disciplines, right, which are applicable to the subject in question, right? am I reading social psychology? Am I reading sociology? Am I reading, some of the psychology around, say, racial identity development? So really having an in-depth understanding of the mechanisms that ultimately shape this thing that I want to write about is incredibly important. So reading on the subject, but also around the subject, I think is key when it comes to being someone who will, come across in writing as knowledgeable about the matter. So history, psychology, all the, the social sciences, right? Beyond just the sort of clinical evidence around whatever it is that I'm writing on. And then next piece of this is really knowing your audience, right? Knowing your audience, and by that I mean every possible reader. So for instance, who is the first person who reads this piece is going to be the editor, right? So who is this editor? If I am writing about racism in medical education, for instance, and the editor is a white man, I may not say the meanest thing about white people in the first paragraph, because then they're going to next, right? Like they're probably going to next my op-ed, just, the moment they see what I've written. So really knowing who every single possible reader of your written material is incredibly helpful in thinking about how it's going to come across. So the first person who reads it is the editor or the screener, right? So really sort of playing to who that editor is, but then also thinking about the readers of the outlet in question. So I had an op-ed in the Washington Post. It's incredibly, widely read. And so there are going to be people who will be sympathetic to what I'm writing about. And then there are people who are going to hate it. There's 150 comments there. Some people are like, why are immigrants coming here to take medical school spots anyways? And you can't help that. But one thing that's incredibly important in terms of knowing your audience is to, one, use language that is accessible, such that people can actually, have take away from what you're writing, but also not condescending to the audience in question, right? So sometimes people may write with an assumption that the people who are reading this know nothing about it, and so they sort of really say, oversimplify the subject matter. So I think it's a really tough balance, right, between using accessible language but also not condescending to the people who are reading. And then lastly, always anticipate how people might push back against whatever point you're making, against the thesis of your op-ed, because that helps shape the sort of tail end where, you've made this really long argument around something, and someone gets to the end and they're like, whatever, I don't believe none of this because of this a priori belief that this person had. But the last paragraph of your op-ed is where you sort of attempt to tackle, right, what might be the most popular counterpoint against your op-ed. And then lastly, know the value added, right? So we've talked about expertise, limitations, knowledge. What is unique about the point or the thesis that you're making in this op-ed? What exactly are you adding to the conversation? And if you realize maybe I'm not adding enough, or maybe, the stuff that I'm writing is tired and other people have already talked about this, then maybe don't write it, right? That value added piece is so important because writing takes a lot of time. You go through a lot of rejection. So always, try to not be repeating points that have already been made, unless you're aiming to reach an audience that is otherwise not being reached by, the other pieces that are out there on the subject. Are there any questions so far? I take a little pause.
Not yet, Max. You're good.
Okay. And so the next thing I want to discuss very briefly, and I think we probably don't need to, belabor this part, is how do you structure an op-ed, right? I think everyone here has probably written some kind of essay. I think, if you went to, we were probably all taught about this sort of five paragraph essay. Some people write longer, some people write shorter. It all depends on what is the outlet, right? So if you're writing for the New Yorker, you're probably writing a 10 paragraph essay versus the New York Times. So typically, an op-ed starts with sort of a lead or a hook, right? That either contextualizes what you're going to talk about, or says something interesting that literally hooks the reader, makes it interesting. Then you finish that sort of paragraph with your with the thesis, right? Okay, what are you about to say in this 1,200 word, 1,000 word article? And then you start building arguments. And typically in that thesis sentence, you sort of, introduce each argument very briefly, right? And then you go on. The next few paragraphs is basically the argument you're making, the evidence evidence. So there's different types of evidence. You may use some amount of anecdotal evidence, but I always find, when you have a certain level of expertise, using empirical evidence is always better because that's, that gives you some credibility. But using anecdotal evidence also sort of personalizes whatever it is that you're arguing in favor of, right? And some of the anecdotal evidence may in fact be used for the hook. So you'll see it in the next few a couple of slides down. I'll talk about how I've used anecdotal evidence to sort of humanize or sort of give a face to the empirical evidence that I'm discussing. And rinse, repeat 3-4 times, if however many points you have. If you are writing an op-ed where you're for instance making policy recommendations, then you want to say this is why we should do, like for instance, I wrote a perspective where I first was describing the problem with the current the pandemic, which is like sort of colliding with the opioid overdose epidemic, right, and especially affecting Black communities. And first, I covered, right, all of the history around disparities in access to methadone and buprenorphine, methadone versus buprenorphine, that kind of stuff, the racialized system that we have. But then I had recommendations to make, right? And so some may argue that recommendations are a form. So we need to start making methadone available in pharmacies. And I show evidence as to why that matters, right? To drive shorter distances, right? So for every recommendation that you make, there should be evidence that supports why exactly you're making that recommendation, and then you conclude, and like I said, rinse, repeat. And then that to be sure paragraph is usually where you put 1 or 2 counterpoints, right? You basically showing that you anticipated why people might not agree with what you're offering, and then explain why they're wrong, right? So sort of like get ahead of of the person that you're trying really hard to convince and who might not be as easily convinced. That's that to be sure paragraph. And then you conclude by bringing back, whatever it is that you were arguing for initially in your introduction. Now, this is the really hard part, I think, is pitching, right? I have many op-eds that are sitting in my computer that never saw the light of day. For every op-ed that I've published, there are probably 3 op-eds that are in my computer just sitting, accruing mold. So the pitch, there are essential things that your pitch must always include. And this, the sort of format or the form of the pitch really varies depending on who you're pitching to, whether the outlet in question is taking the pitch where they have like a form on their website where you have to like actually insert the different elements of the pitch, versus whether you're directly emailing the editor or emailing like op-eds at NewYorkTimes.com or something like that. But there should always be, first, what is it that you're pitching, right? Because sometimes people make the mistake of first talking about themselves. The editor doesn't care to hear who you are until they find that whatever it is that you're pitching is actually interesting, right? So you prioritize what is it that you're pitching, why does it matter, and how is it current? And sometimes it's really hard to pitch things that are kind of timeless, right? And for those things, there are specific outlets, right? That sort of that have space for things that are timeless, that aren't necessarily newsy, but otherwise are important. And then who are you and why are you the right person to discuss this subject? Like, why should you, for instance, the medical student, and I guess soon enough the resident or whoever, right? Why should you be the person to write this op-ed, and why not your professor, right? And so this is where one may talk about expertise. And this is exactly why I was saying earlier that you need to think about all of this before you even start writing, right? Knowing exactly, like, do you have to be the person to write this? Is there somebody out there better than you? And by better, better positioned to write this. And then making the argument for why this is a good fit for the outlet and its audience. And depending on who you're pitching to, a summary of the argument is nice. And again, depending on how urgent the thing that you're pitching is, you want to say, in polite terms. So some outlets are usually will tell, like the New York Times, for instance, will tell you, if you haven't heard from us in 48 hours, move on, go elsewhere. We've probably read it and we don't want it. But there are some outlets, for instance, that will say, we'll take a week, right? But if you're writing about a vote that's about to happen in Congress in 3 days, you have to tell this journal, I really want to get this out in a certain amount of time. And therefore, if you haven't if I don't hear from you in 48 hours, I think 48 hours is pretty typical in terms of courtesy that you give an editor. If I don't hear from you in 48 hours, I will pitch elsewhere. Never pitch two places at the same time. It is messy. I know people do it, but you do not want, it's like getting caught, messing around with two people at the same time. Excuse, maybe this is not appropriate for this subject, for this presentation, but it's basically pitching the same op-ed simultaneously in two outlets. If you ever end up, getting like one place or both places say yes, but like one place said yes before, and you're like, oh, sorry, actually, I'm going to publish it elsewhere, then you kind of burn that bridge with the editor. And it's actually really important, especially with outlets that, have like really big standing, like the Post and the Times. It is good to build relationships with those editors, because then the next time you want to pitch, you can actually email the editor, and it's really nice. When I email, the Washington Post editor, he actually like responds back to me, as opposed to emailing the op-eds at WashingtonPost.com, and then they're like, oh, sorry, it's like a random person who responds to you. The rejection is a little less harsh in that sense. So just very briefly, I'm going to show an example of a successful pitch. This is an op-ed I wrote after every medical school decided to become anti-racist overnight. And so this is the first thing, right? What are you pitching, right? I am reaching out to pitch an op-ed about institutional responses to police brutality and anti-Blackness from a medical student's perspective. What am I discussing? I described the stark difference. So I started med school in 2016, right? Philando Castile was killed that year, among many other Black men, right? So I started there was a stark difference, right? In 2016, it was taboo, right, for white coats for Black lives to be a thing. Like, people even got in trouble at school. And then out of nowhere in 2020, everyone's anti-racist. Like, why, right? So this is why I'm writing this. And so then this is the piece where I say, why me, right? It's very personal to me. I'm a young Black man. I'm in medical school. I literally, when I was pitching this, I had the police called on me by a bus driver, not super, like the day I took step 2. So like, positioning myself as being the right person to talk about this. And then I, sort of follow up with like, this is the summary. This is exactly what I'm going to talk about in this op-ed. Just very briefly, I don't know whether you all have had a chance to read these. These are just a few headlines, and I want to discuss, thinking about audiences and writing samples. So if you've read any of the sort of pre-reading material, right? One thing that I often think about is basically, one, do I want to send something to an academic versus a lay press audience? And that has a lot to do, again, with who I want to read the stuff. So for instance, the piece I wrote in Maternal and Child Health, the government's involvement in prenatal drug testing may be toxic. Although I was saying this about what the government is doing, around, prenatal drug testing, my ultimate point was that I want physicians to stop abiding by these laws, right? Like, literally, I was like, physicians should engage in a civil disobedience. So I send this to an academic outlet, knowing that physicians are going to be the people, like people who read maternal and child health are nurses and physicians. So that's the outlet that I want this to be in. And the other part of it is, as a student or as someone in academia, currency matters. So having something published in an academic journal is slightly more important from that, like academic currency perspective, like on your CV, than having it published on, say, I don't know, Kevin MD. Now, on the flip side, there are issues that are sort of like public life issues, right? And you want those things to be published in the lay press. So for instance, when the Trump administration decided that they would forbid international students who are from entering the country if they're going to schools that were going entirely virtual, during the pandemic. Well, the Washington Post was the best place to put this. Yeah, I got super lucky. I never thought I would have an op-ed in the Washington Post, before being an actual MD, right? And how I know this was effective, one, number of views, that kind of stuff, but it ended up being cited in an amicus brief that like I think 73 or so, like, nearly 100 universities filed a lawsuit against the government, and they cited this op-ed, right? So that's how I know, okay, this was the right outlet to place this in. Another example was this piece I wrote in the Philadelphia Inquirer about bike shares for essential workers. The target, I literally wanted the city and the company that runs bike shares in Philly to make bike share free for at least people who are essential workers. And so the city, like, that's a city specific issue, and it would not have made sense for me to write that, say, in Kevin MD or even in the Washington Post or in the New York Times, right? So then I targeted the Philadelphia Inquirer, that's like the city's, and it was in the Sunday paper, and like 10 days later, lo and behold, Indigo dropped the prices for bike shares. I can't necessarily claim credit, right? This is the hard part about writing for policy is you can't quite isolate, right, the effect size of whatever you're writing did. I can tell you that because Harvard University used my op-ed in this lawsuit, that's why they won. I can't, but like I contributed to the discourse in that sense, right? And then the last piece I want to share is there are times when you hold very specific expertise, right? So like, as I mentioned earlier, my research is about, or some of my research is about prenatal opioid use disorder. And so then I wrote it, like I literally did studies on this, right? So when the paper comes out, of course it's, it's in JAMA Network Open, or like my other paper that's in the Green Journal, Obstetrics and Gynecology. But if I want policymakers to be aware, right, of this issue, and by policymakers, I mean, say, for instance, people who are at NIDA, who are not academics, right? But they have some amount of power around this like whole X waiver issue, right? So then I wrote a policy brief, right, around basically kind of summarizing the findings of my paper, and also adding some arguments that I think would not have made it into the actual sort of academic publication, right? So and this policy brief, this is published in the Leonard Davis Institute's like sort of like policy blog, right? So these are the ways I've thought about, okay, where am I going to put this, right? And the Atlas Medical Profession Speaking Out for Black Lives, this was in on Dark Magazine, which it's MIT based. They take forever to publish stuff. So they like to publish things that are more so timeless, but current at the same time. So just a little contrast of the writing samples that I shared earlier and what my thought process was around, pitching and writing each. Okay, so we have about maybe 20 minutes left, and I want us to take like, say, 5 to 10 minutes to both draft. I mean, you could do both if if you feel up to it. But I want to ask that everyone takes a little, let's say 3 minutes, just in the interest of time. Take 3 minutes to start at least writing the lead or the hook for an op-ed about an issue that you care a lot about. And I think there may be a policy brief assignment for this course, actually. So why don't we let's get started on that. Write the hook. Typically the hook on an op-ed is like 2-3 lines. Write the hook. And I'm going to invite a few people to share. If no one wants to share, I'll write a hook myself so I can also share. Or I mean, Kelly, do you think you're going to be up for it?
Yeah,
Okay,
absolutely.
great.
I have my Microsoft Word open. I am ready to go.
Great. All right. So everybody write your hook, and then also quickly draft the pitch for an op-ed. And let's say you're pitching to like a big national outlet or something, or anybody you want, whoever you think needs to read your op-ed. So let's take a little bit of time. I'm gonna turn my camera off, and actually gonna write with pen and paper. Okay, and let's get back here at like, I don't know, 7:43. After this, I only have like 2 slides. Okay, so all right.
If you have questions about any part of your writing process in the next 10 minutes, drop them in the chat. We're here to answer them.
All right, let's start back. Does anyone want to share their lead?
Well, I'm happy to.
Okay, let's go.
Yeah. So, should I private it all or should I just go for it?
Go for it.
Okay. An Earth, Wind, and Fire hit record and internationally recognized interventions preventing potentially fatal disease aren't always used in the same sentence, but they are for My COVID MD. My COVID MD is a pandemic response initiative founded by emergency medicine physician and community advocate, Dr. Nana Nguemeni, under the umbrella of community organization Shared Harvest. She, alongside a trusted staff of allied health professionals, student volunteers, and others, have coordinated culturally relevant, accessible, and free service initiatives to help people get tested, seen by health professionals, and vaccinated. I had the pleasure of volunteering in a few of her Vax Equity events, focusing on vaccinating residents of some of Southern California's most under-resourced communities.
Thank you. Does anyone have a comment about Kelly's lead?
Please do, because I actually do want to write this, so please do.
I really liked, Kelly, how in particular with your lead, you set the stage, but also you went right into like the meat and the substance of what you're going to be writing about. Sometimes with like some of these leads, you can read an entire paragraph and still not know the direction in which it's headed. I feel very comfortable in like what your paper is going to be headed in following that.
I love it.
Thanks, Reese. I swear Reese wasn't a plant, y'all.
And does anyone want to read their pitch, or are you guys going to make Kelly also read her pitch?
I personally only finished the intro, which I was still editing a little bit. But
okay, yeah, let's hear it. I do want to hear at least one pitch. I would love to write, because that's so key. A lot, you can write all you want, but if you don't pitch it well, it's never going to see light of day. So one more intro, and then I hope somebody has a pitch for us. I already gave a pitch example, so I would love to see some fresh material.
So mine reads, I reach for my albuterol inhaler as I've now been diagnosed with chronic obstructive pulmonary disease, a result of being born in the wrong area at the wrong time. Never smoked, but I was diagnosed with asthma as a byproduct of simply living in LA and now living amongst an annual fire season that rains down ash from the sky. The future is now, and this is the reality for thousands of Californians. And this is kind of like where I stopped, but I basically wanted to lead into like 2020 was our worst fire season on record, and what have we done a year later to address it? Nice.
Yeah, I love, so one of my favorite things is to use personal narratives when fitting. Sometimes I like using like things in pop culture, and I think both of you hit those my two favorite ways to make an introduction interesting, right? So you basically either appeal to people's emotions by, at least that's my approach, right? Appeal to people's emotions by using something personal and deep, right? Or use something that people know a lot about, which is things going on in pop culture. And depending on what it is that you're talking about, oftentimes you may have to like give it a little bit more context and then go into the hook, or you could start with the hook and then give it a little bit more context. So like, for instance, my Washington Post piece, I start by saying, Donald Trump is trying to kick immigrants out of colleges, right? And then I go, well, I tried to study, in Cameroon, like with a 6-hour time difference and like shoddy internet, and it just did not work. So I don't think this will work for anybody who is forced to stay abroad. So it can vary, right? But either way, I think, you could start with the context and then say what's personal, or you could start what's personal it's very much dependent on personal style. All right, who's got a pitch for us?
I do if no one else does. So
Yeah.
please, the audience, if you do have
I'm gonna just say you're a
our
plant.
time, this is a safe space. And then we'll get into some questions. But I'll go for it. COVID-19 vaccines are not getting into arms of Black and brown people at the same rates as white people. Hesitancy is in part to blame, but access is an issue that is often under-recognized and therefore fails to be addressed in a culturally relevant way. Not all vaccination efforts are created equal, and in this essay, I outline a culturally relevant pandemic response initiative for under-resourced communities in Southern California. I'm a Black female medical student and soon-to-be family medicine physician dedicated to preventive healthcare, care for marginalized communities, and ensuring quality, culturally humble care delivery in all settings. Raised in a Kojic church on Crenshaw and Jefferson, I see the power the religious community has in reaching communities, especially Black communities, and I'm proud of the work of my COVID-MD in setting up vaccine clinics, often at local churches in the hood.
That's perfect. You hit all the points, right? Why, like, what is the problem you're tackling? Why is this important? Why is it urgent and timely? And why you, right? You're a Black woman, you care about this, you were raised in a church, and this initiative that you're about to talk about is based in a church. So that is, I mean, it's a perfect pitch, right? If I were an editor and that this subject was something that my outlet is interested in publishing, I would want to hear from you very specifically on, on this matter. All right, I'm gonna quickly go over the last slide, just some few reflections, and I'll take questions if there are any. There are lots of challenges when you write, and I think the main one is rejection. And if you take it personally, you may never publish, right? So like for me, it took me, 4 years or 5 years of writing all the time to like get pieces in like the Philadelphia Inquirer and the Washington Post, like right. I was writing in like smaller outlets for the longest before I eventually started, you know, being out there like that. So just take no for an answer, but never stop submitting. If you don't submit, you won't publish, right? That's the rate limiting step, is submitting and pitching. The next thing I want to share is thinking about leveraging your writing. So when you do write something, make sure you share with people around you. Make sure you share it on your social media with friends, family, whoever, right? You never know which editor is going to stumble upon your writing and be like, huh, this person's good. Next time I want something from them. I've literally had this happen to me. An editor for Inside Higher Ed magazine, like DM me on Twitter and was like, do you want to write for us? You write some cool stuff, right? So always like share the stuff you write everywhere. Somebody may stumble upon it, being LinkedIn, Twitter, whatever. The other thing that I will say is sometimes literally ask on social media, hey, I have this that's actually how I got the piece in the Washington Post. I said, editors, this Donald Trump rule is ridiculous. I have tried to study, for like classes happening in America while in Cameroon with shitty internet, and it didn't work. Please let me write about it. And it just took off on Twitter. People retweeted it over and over and over. And this Washington Post editor responded and was like, Max, I'm interested in reading this. Email me. I emailed him. He could have said, actually, I don't like this, never mind. And he just rolled with the punches. But right, literally leveraging social media will get people to respond, or at least will give you exposure. And like the byproduct of that is that after all those retweets, lots of people also just followed me, right? So talking about the things that you're writing about will also increase the audience and your reach. Lastly, I think writing with others is really cool. It opens your horizons. Other people who may have connections you can leverage your network, right? There are people who have established relationships with editors at different outlets. You may see some medical students who publish all the time in, I don't know, Boston Globe, and write with them and leverage that network. Of course, you got to build a relationship first before you randomly ask people to write together. But I think writing with others is a way to also just get your voice out there with almost kind of like a co-writer who helps carry you to the finish line. I already talked about rejection. Just resources. I use the op-ed project all the time when I like need a refresher on like how do I pitch to the New York Times versus USA Today? Use your university's writing centers. This is like an underutilized resource. It's not just for freshmen in the English class. You can reach out to the writing center. You can reach out to the librarians if you need help with anything that you're writing. I just discovered Grammarly at my big age. For proofreading, typos are no. People reject stuff just because of typos. And then, if you're someone who's just getting started with writing, Kevin MD will publish almost anything. There's a lot of good stuff there. There's a lot of junk there, but it's a good way to get your voice out there. That the first thing I ever published was about racial segregation in my med school classroom in Kevin MD. I think it was well written, but like I didn't even dream to pitch somewhere higher. But I think it's a good place to start. In training in-house, these are student or trainee-led outlets that welcome, and they're fairly well peer reviewed. Like their editors can actually be irritating because they're more than thorough. But these are good opportunities to get your voice out there. So I encourage you to take advantage of the op-ed project. They actually host seminars, and they're not free, but they do have scholarships if you justify why you need a scholarship, and also if you promise that you're actually going to write an op-ed. So typically at the end of the seminar, they pair you with someone who's like has an editorial role somewhere and help you literally, get your op-ed to the finish line and with writing and pitching. So highly encourage checking out the op-ed project. And then I'll take any questions if there are those.
There are actually. So
Yay.
first, thank you, Max. This is I soaked this up. This was probably pretty self-interested, but I appreciate you because you come from a really authentic place in your journalism and your writing, and that's why I wanted you to come into this space, and you killed it. A question that we've already got is I bet this question might be asked a lot, but how does one find their voice when writing, and how much should it come through in policy writing or writing for advocacy?
Yeah, that's a good question. I mean, again, I think, like I said earlier in the beginning, right? I was like, who are you advocating for, right? If you're advocating for yourself or for a community that you belong to, then your quote unquote voice, like, sharing your own personal experiences and how something hurts you. Like, for instance, I have a piece out there and I think it's in training, or even the Washington Post piece, right? Like I say something along the lines of, my heart aches for fellow international students who are being, put through the stress of like the Trump administration, blah, blah, blah. I think I went really personal in that piece because I too am an international student, right? And so even though I am not in the position where like Yale didn't go virtual and I'm in medical school, so I that wasn't my problem, right? But like I have, like I identify with that concern and I could be as forceful as I wanted in that op-ed, right? I literally was like, the cruelty is the point. I quite literally called the government cruel. Now, in the piece that I am writing, that I wrote, for instance, about prenatal substance use disorder, I don't have reproductive capacity from a pregnancy perspective. So, the most I could do is like share what it was like, right, to have a patient express her frustration about the fact that we have to, like, social work is going to report her to CPS and her baby is going to have a case before she's born, right? I convey this patient's frustration and also my sort of powerlessness as a trainee in that situation, but I try really hard not to make it about me and my voice if the thing that I'm writing is about advocating for people who there's a lot more distance, right, from me and them. So that's what I would say. I think it really depends on what you're writing about. If it's something, if you're writing primarily about something that's incredibly personal, pour your heart out there. But if you're like writing about, access to buprenorphine for prenatal substance use disorder, and you're not someone who can be pregnant, or you're not someone who has a substance use disorder, maybe don't make it about you and make it more about the people that you're advocating for.
We'll be talking in other sessions around how to leverage your personal story in both lobbying and hearing settings. So keep that same energy. Telling your story and leveraging emotion to tell that story can be powerful in a media outlet, just like it can be in person. So I hope that answers your question. The feedback survey is open, polleverywhere.com/AHPE 2021. We are here for a couple more questions in the last minute here. And then if you are part of our formally registered course, we'll be talking about the policy memo writing assignment and the specific components of it. A question that we got from the audience, one of the pieces of advice I've been given is to write an op-ed piece, but to wait for a major news event that reinforces your stance and to cite it to submit that opinion. How do you feel about being pre-prepared with an op-ed and waiting for that window of opportunity?
Yeah, I mean, again, I think it varies. There's an element of ethics around, like, I don't know, being like an op-ed vulture. I know those people who are like this. They're like, it's like, how did you have time to write this, right? But I think if you're someone who writes all the time, anyways, right? Like, at any given time, I have like 5 things that upset me, and I'm writing about them, and it may not, and I may not finish writing the piece. It may not be timely, and then something happens in the news, and I'm like, oh shit, I need to go back to that thing I had already started writing. I think that's one thing, but I do think it's another, right, to be like a publishing vulture, because there literally are people like that, right, where like the goal is to make it in the medical media space, and so they're like, then something happens, if somebody gets shot, they already got something published the next day. It looks, I personally, I think it's like a little, I don't know, it makes me cringe if that's the approach, where like, oh, you have stuff sitting around like with the intention of waiting for something to happen in the news, as opposed to someone who, I mean, I am writing all the time, right? Like I don't watch TV. A lot of what I do is write. I have my notes up on my phone. I voice, I like dictate stuff sometimes when I get an idea, or like take notes. So the writing thing for me is kind of perpetual, right? But it isn't like, oh, I'm waiting for something to happen in the news for me to then just dump, send this pitch out. It's almost like waiting for something bad to happen to people, right? And then, oh, this is my opportunity to shine. It feels a little, cringy. At least to me, but do you, if that feels fine to you. I'm sure it works. People do it.
Totally. I appreciate that answer. And I appreciate you, Max, for being here with us today. We want to hear
Thank
your
you, Kelly.
feedback regarding this session. And if you are interested in writing further, if you're interested in submitting that op-ed, leverage us. We're happy to be second eyes on the pieces that you want to submit, or give you some tips and tricks about where might be best to submit, etc. That's what we're here for. So thank you for being here, Max.